Hi, my name's Elizabeth Hess. I'm here with Julie Pryde. She's the administrator of the Champaign-Urbana Public Health District. Thank you again for joining me, Julie.
Absolutely. Thank you.
The students seem to have gotten this message that we need to socially distance, wash your hands, wear a mask. Is it true? Do we have our numbers under control on campus?
Well, definitely the U of I is doing a much better job. You have to remember that a lot of the kids came here to begin with already infected. So, we had to get over that big hump of kids coming in infected. So once we got through those, and there have definitely been outbreaks on campus in, housing and places like that. So we're trying to work on that with everyone from the university to the apartment owners to, the frat houses. They've had some parties as well. So, but for the most part, they're really doing a pretty good job.
What I don't understand is that other states, New Jersey had its highest caseload last Saturday than they did since June. Florida is now saying, you know what, just reopen every bar, every restaurant. How are other states just throwing caution to the wind and opening things up like that?
Well, it's irresponsible, and people are going to die needlessly. Florida, I don't even know what to say about that. Yeah, they're just, it's almost as if they're trying to see how many people that they can get infected. I'm not kidding when I say that. I've just never seen anything like it. They're just, the things that they're doing is absolutely not even remotely based in public health. It's based in magical thinking, and people will die from this, because if people only are looking, to the government there to get their information, they're going to be having a lot of problems, because the information coming out of the governor's office there is concerning. They're going to overwhelm their healthcare systems, and that's what we're going to start seeing. We'll see a lot of places this winter, I'm afraid, having their healthcare systems become overwhelmed.
Well, Florida's not going to be in great shape if their neighboring state, Georgia, continues to open things up too. So I'm bracing for that in the South. Dr. Fauci has said all along that pandemics always have at least two waves. Have we even finished the first wave yet?
No, we have not. Europe is starting their second one. What we did here is you're all, what we did is you will continue to see the little ups and downs. Champaign County's, like every place else, we have our ups and downs as far as the cases. But as a country, what we've actually done, if you look at the numbers, is it's just been kind of a steady climb up. And so when we go into fall and winter, instead of starting where we were originally, or at least down here, we're going to be starting up at the new baseline. So it is concerning. We're already losing 1,000 or more people, 1,000 or more Americans a day in the United States, which is that. I don't know why it's not concerning people. I actually wrote something down here today thinking about this. You know how 9/11, they read the names of everyone killed in that. To read a name takes about 3 seconds. So right now, as of today, there are 204,597 deaths in the United States in the 8 months since it started. That, if you were reading nonstop, same person, 3 seconds a name, it would take 170 and a half hours. So that's actually over 7 days of reading just to say the names of the people who have died of this pandemic thus far. We're not going into winter. We're not there yet. And there have been some estimates that by the height of this in the winter, the US could be having 3,000 deaths a day. That would be like having a 9/11 style, death rate every day. And that is why people aren't taking this seriously. I don't know, but they need to. Luckily, we are in a community where people do take it seriously, and we can see that by the numbers. I know recently somebody asked me in one of the News Gazette articles, well, Champaign's only had 20 deaths. Shouldn't you be worried about other things like gun violence? And they act like it's just a magical thing that we've only had 20 deaths here. What they're not understanding is that There is a massive testing game going on in Champaign County. We've already done over 500,000 tests. Massive testing game, massive contact tracing game. The partners, including the cities, the county, the healthcare system, public health, we've all worked at the university, Parkland, all of the schools. We've worked together for at least 15 years on pandemic planning. So to act like this is just some sort of, oh, guess what? You only have 20 deaths. Well, yeah, there's a lot of work behind that, keeping the cases where they are in this county. And it's not just a lot of our work, it's a lot of the people in our community that are doing the right thing. So to act like this just sort of, isn't a big deal because we haven't had it so bad in Champaign County is exactly what public health is used to, because that happens all the time. If you prevent something, then it's like, well, it wasn't that bad. So very frustrating.
That bears repeating. We could be up to 3,000 deaths a day just from COVID.
Correct.
Dr. Sanjay Gupta said there are 5 common misconceptions about the virus. And one of them that you hear over and over again is that it's just like the flu, that you'll get it and get over it. I've never seen death numbers from the flu in recent years. So tell me your thoughts on that.
COVID is nothing like flu, other than, like a lot of viral illnesses, you have a fever and body aches and certain symptoms that are similar, but that's where it ends. I mean, this is not that. We know a tremendous amount about flu because it's been around forever. We do not know much about COVID. It's basically been being studied, this particular strain, for 9 months. So it's nothing like that. We are seeing people that are having a hard time recovering from this, even though they're no longer infectious. They are not back to normal. It attacks all parts of the body. The circulatory system seems to be one of the areas. So it's not like flu, but don't get me wrong, flu also can be very deadly to people. I'm always, every year I try to set my hair on fire to encourage people to get the flu shots. This year, I am very happy. We've been getting calls from all over that the flu shot lines are long, and the U of I lines are long, and people that come in here are interested in getting them. And so it's really our community, again, as usual, our community listens. They read, they pay attention to things, and they help out.
The thing that we're looking forward to now is a vaccine. Once we get a vaccine, at what point can we say, okay, we're safe, we can take off our masks, we can congregate again? Are those correlating at all?
So if we get a safe and effective vaccine, what has to happen before we can let down these prevention measures is that we have to have enough people vaccinated to have herd immunity. Otherwise, it's just going to keep circulating. It's just going to keep causing problems. Obviously, the more people vaccinated, the less spread that's possible. So I always like to, use the little example of vulnerable people. It can just pass from person to person to person. But if you get a vaccinated person, then, it stops there. So the more vaccinated people we have, the better.
People who are vulnerable could be people over a certain age. And I know you're recommending pneumonia shots and you're recommending flu shots. There is a misconception as well that young people can't get COVID or aren't as affected by it. But aren't there horror stories of young people on ventilators and with long-term effects that we don't even know about yet?
Oh yeah, there are stories all over the place. Cases of young people. There have been deaths. There have been deaths in everyone from infants all the way up, to 18-year-olds. There have been deaths in all those categories, and people with no underlying health conditions. There are people who have had to have amputations. There are young people who have lung transplants, or who have permanent lung damage, or who have heart problems after this. So it is not something that you want to underestimate. This is an extremely infectious virus. You may be one of the ones, or your kid may be one of the ones who recover from it and are fine. But why would you want to take that risk? I don't understand that. That's just not, you have no idea what the outcome may be. You certainly know that if you're older, or if you have certain underlying health conditions, you have a higher likelihood of having a problem, but no one is immune from a potential super bad case of this.
What about the rules on congregating right now? I can't keep track of what phase we're in here in the state of Illinois. If somebody wants to go to church or they want to attend an indoor meeting, are we still at 50? Are we 100? Where are we with that?
Well, most places, again, in our community are paying attention to it and doing a really good job. So it depends on what the event is. It should not be more than 50. And even if you're indoors, you have to still be socially distanced, and you have to have the mask on. It's going to be time and distance that are going to be the problems when you go inside in winter. And that's why we're so concerned about the winter in general. People spend more time inside. Obviously, it's cold out there, and so you have more likelihood of people being around each other. And again, it's not so much like going to the grocery store, because we know that that's working really well. Wearing the masks, staying away from each other in the store, and moving through the line. You're not in the store for hours, hopefully. But when you do other things where you're in there's a bunch of people close together and you're all breathing, that virus is going to be able to build up in the air if masks aren't worn all over the place, and if there's not enough ventilation. So it's just, everything is different, but that's not going to change. I mean, there's no way that we're going to be able to make this different until the pandemic ends. The guidance is not going to change.
The guidance to return to school has been decided in the fall in Champaign now, starting October to December. Elementary school kids have the option of going 2 or 3 hours a day in the morning or the afternoon. Middle school, high school are staying home. I know there's no ideal scenario for everyone, but do you think this is a good idea now?
Yeah, I think that we have a lot of schools out there that are already in this hybrid type of learning situation. And especially with the younger kids, it really can work. The main thing is going to be to make sure that the kids their desks are at least 6 feet apart, and they're wearing masks all day. And they know how to do it with cohorting them and not mixing the kids together and things like that. So we've had schools in just every place has had people who come in and they have the virus. You're not going to be able to prevent that. But if you're doing the things that you need to do, which again is at least 6 foot away from these kids from each other, masks, hand washing, that type of stuff, you should be able to prevent an outbreak. So yeah, I think that the plan that the Champaign schools has put forth right now looks like a good one. And I really like that they offer the options, because again, nobody has time to go through every single family and try to decide what's best for them. They need to know, even if school's back in and they have somebody at risk at home, they need to have that option to continue the online learning. So I think it looks pretty good.
I know that you are very happy with how this community has come together. There are occasionally people who you encounter without masks out inside in places. Other countries are fining people for not wearing masks. Would you like to see that happen here in this country?
Well, it can, I suppose, but the thing is, in our community, people are doing, a really good job for the most part. There are going to be some businesses who end up probably getting fined, and maybe even some closed temporarily if they are not maintaining their own environment. So, it does take more work, but it is that important. We have to do it. They have to protect their employees, and we have to protect the community. So, yeah. Do we have any of us have time to go around and, chase people down and give them a fine for a mask? No, we don't. So luckily the majority of people are doing what they need to do.
This weekend, I tried to get a flu shot, and it was a 70 car line everywhere I went. How happy does that make you right now?
That makes me very happy. There are a million options in this town. There's a little hyperbole. There are lots and lots of options in this community. So, and most of them take any of the insurance or Medicaid, or there are a lot of places available for people who don't have insurance. So please continue to go out there. If it's too long to wait in line, go find another place, because there's lots of flu vaccine out there. So I'm very happy. I heard that all weekend. I got mine really early. I know a lot of other people are getting them, and I saw it all over Facebook. And that's really a good thing because that's going to help protect our healthcare system.
And before I let you go, speaking of our healthcare system, I want to end every Q&A with you reminding people that elections have consequences and that healthcare is on the ballot this time. How important is it in this year to vote?
Well, always I want people to vote, but definitely when you vote, make an assessment of your own situation. And I will say, so far, Champaign County is doing a great job. The early voting is in Brookings, and it's very large space, and it was very well organized. And there's also going to be so you have early voting if you want to do that, and it should be less crowded. And then you'll have the vote by mail option, or you can get the vote by mail, get your ballot in the mail, and then drop it in one of the drop boxes that are around town, the secure drop boxes. Or you can go on the actual election day. But when you go, just make sure that you follow the guidelines to help keep everyone safe. Wear your mask, and wash your hands before you get in there and after, and just keep your distance, and we should be good to go.
Former Urbana City Council member Aaron Ammons has done a fantastic job getting that office up to speed and up to date, and everything is moving smoothly. So thank you for that. Thank you, Urbana Mayor Diane Marlin, for continuing to support these shows. Of course, Jason Liggett, we wouldn't be here without you and all your editing and all your magic with UPTV. Thank you for that. And Julie Pryde, you and all of your staff are amazing. Thank you so much. The administrator of the Champaign-Urbana Public Health District, Julie Pryde, we're all indebted to you. Thank you.